of hospice clients in nursing facilities, the payment and process change that is taking place on May 1st of 2013. So just an introduction, who we have here today with us. We have hospice providers on the line. Hopefully we have some managed and coordinated care representatives as well. And then do we just want to go around the room and introduce who's here?
Judith Van Oslo, I'm the Hospice Policy Analyst at DMAP.
Cindy Susi, I'm with Aging and People with Disabilities, Medicaid Rates. Becky Calipre, Aging and People with Disabilities Policy.
Vivian Van Hatten with Provider Services, Nursing Facility Liaison.
All right, and this is Jennifer Smith again. I am the Oregon Health Plan Trainer. So our topics today, a little bit of a review from when we had the training last time, but we do have some updated information, so stay tuned for that. We're going to talk about the payment process change and billing for hospice clients that are in nursing facilities. We'll have a quick Oregon Health Plan overview and breakdown. That way you understand why you have folks in the room from both DMAP, the Division of Medical Assistance Programs, and APD, Aging and People with Disabilities. We'll talk about the roles and responsibilities of both the hospice provider and the nursing facility. And then we'll talk about communication between those two entities and coordination of client care. And then, of course, Medicaid and Medicare coverage and eligibility. That way you understand who you're billing, whether or not something is covered by those two different organizations. All right, so the payment process change that's taking place, again, that's May 1st, 2013. That's a new date. That's when the new payment process for hospice clients in nursing facilities will take place. And that's for date of service May 1st, 2013 forward. So what's going to happen with that change? The nursing facilities will bill hospice for room and board for the bundled services. Hospice providers will bill Medicaid for both the nursing facility room and board bundled payment and for the hospice service. Now when you bill Medicaid for the nursing facility room and board services, you want to make sure that you include fee-for-service and managed or coordinated care clients for that nursing facility claim. And then hospice will receive payment from Medicaid and pay the nursing facility according to their contract. So those are the changes that are taking place. Again, that's date of service May 1st forward. And then why is this happening? This is a bit of a review here. Per federal statute, OHP is prohibited from paying nursing facilities directly for their services when a client has elected hospice care. So Oregon Health Plan is required to pay the hospice an additional amount. According to federal statute, that is at least 95% of what we would pay the nursing facility. And Oregon Medicaid, in parentheses there, you see that we're going to pay 100%. So that's another change from previous training. So hospice providers will then receive payment, again, for the nursing facility room and board services, and they'll pay the nursing facility. So how do you comply? Excuse me. The hospice provider and the nursing facility will have a written contract on file and available upon request. And it will address the provision of hospice care and the method of payment between the hospice and the nursing facility. And you'll see that references one of our Oregon administrative rules down there at the bottom of the page. And then also both providers are going to work together to coordinate care for the client and make sure that that billing and payment process is taking place appropriately. So the hospice is serving as the overarching manager of care, and they maintain overall professional management of the medical plan of care. And then the nursing facility will continue to provide nursing facility services while coordinating with the hospice. Okay, so just a brief overview of the Oregon Health Plan. This might be quite a review for most folks on the line, but just to make sure that you understand the breakdown here. The Oregon Health Plan is Oregon's Medicaid program. Medicaid in Oregon is administered by the Oregon Health Authority. And then a division of the Oregon Health Authority is Medical Assistance Programs, or DMAP. And what we do is, at least how it pertains to you, what we do at DMAP is we maintain hospice policies and rules. We handle provider enrollment and billing and payment to all OHP providers. And then some policies are maintained by the Department of Human Services. So this is where aging and people with disabilities comes in. They maintain nursing facility policies and the rules for billing and payment to nursing facility providers. So even though DMAP is kind of maintaining billing and payment, the rules for that billing and payment to nursing facilities is done by APD. Okay, we do have a question. Will we be able to download the slides for this program? So I did send them out to everyone who was registered as of 7:45 this morning. If you didn't receive them, what I'm going to do is I'm going to go ahead and send another email out after we're done today. So if you want to go ahead and put in your email address, I can make sure that you get those as soon as we're finished up. Okay, we're also going to post the slides on our website, as well as the video from training today. Okay, so let's talk a little bit about nursing facility services. Nursing facility care is intended to help people who can no longer meet their own daily needs. Nursing facilities provide a range of social and medical services for people who need assistance with daily living tasks. And their goal is to provide comfortable home-like atmospheres for people who need 24-hour medical oversight. So activities of daily living, just a breakdown here. These are personal functional activities required for continued well-being. You'll see that'll direct you to the bottom of the page where we have ADL limitations are used to determine Medicaid eligibility. So that's something that the nursing facilities are keeping an eye on as they have a resident, whether or not they're Medicaid eligible. So including in activities of daily living, we have eating and nutrition, elimination, incontinence, toileting and cleansing, personal hygiene, dressing and grooming, mobility, and cognition. And again, those limitations are used to determine Medicaid eligibility, and nursing facilities are constantly monitoring that. So the nursing facility care scope, care includes all of the following and may be delivered in collaboration with the hospice. So there's nursing care, 24 hours a day. There's on-site physical rehabilitation and end-of-life care. And these are the revenue codes and reimbursement for nursing facilities bundled services. So revenue code 658 is the basic, and there's the rate there. 191 is complex medical. 192 is pediatric, and 199 is special contract. So you can see that this is going to take some coordination of care between the nursing facilities and the hospice provider. And these rates that you see on this page are statewide rates for those services. Next question. So will hospice providers still use revenue code 651 for per diem rate, and then on the same billing also use revenue code 658 for the daily rate to cover the nursing facility cost? Or is everything under the 658 revenue code? So you'll still bill your hospice services as you normally do. This is just in addition to your hospice service. So what you could do is have one claim that has one row that is revenue code 651 for the hospice services, and then have a second line item for the nursing facility bundled services. Also something to keep in mind, there will be new nursing facility rates coming up on July 1st of 2013. So we'll keep you folks updated on that. I believe, Judith, didn't you say that we included the nursing facility rates on one of the hospice documents online as well? Wasn't there a table or something that outlines the rates?
Oh, yes.
Okay.
Yeah, the rate
Yeah.
chart.
And I believe we have that at the end of the slideshow as a link.
And
So,
it also went out in the provider announcement.
okay. Very good. Next question. How is it determined which patients are complex and which are basic? Is bundled service the 191 complex medical? So again, this is where you're going to coordinate care with the nursing facility. They do know which rate they're supposed to receive for each client. So you would coordinate care with them to know which or revenue code that you would be using to bill for their services.
And the hospice should be getting a bill from the nursing facility, which would have that in.
Right. So next question is, so we might use either 658 or 191. That's correct. So your bill for nursing facilities is going to be one of these. It's never going to be a combination of these. Okay, let's go ahead and move on from there. So just a little bit about nursing facilities and what they need to do throughout this process. That way there's a clear line between the two, what the hospice provider should be doing and what the nursing facility should be doing. Excuse me. So nursing facilities will continue to serve OHP clients as required by the APD rules. This should be a seamless process for clients, although clients and their families do need to be kept informed. Nursing facilities will also continue to collect any patient liability, and they'll report that amount and any changes to the hospice. So some patients that are in nursing facilities have a liability, and that is reported on the claim and deducted from the amount that Medicaid pays. Also, they will work with hospice providers to coordinate the medical care and billing, and then they'll bill the hospice provider for the bundled services. So those are nursing facility responsibilities. And then hospice providers. This is what hospice providers need to do. So hospice will initiate or continue hospice service to clients. Again, seamless process for clients, although their families should be kept informed. Hospice providers will implement coordination of care and educate nursing facility staff on the hospice role as manager of care. Both providers will work together to coordinate care. And then the hospice provider is billing Medicaid for both the hospice service and the room and board for the nursing facilities. And then once you receive that payment, you will pay the nursing facilities. Okay, so let's stop for a couple more questions here. Oh, only one. Let me see. Next question, would a patient's level of care change mid-month? Right? It could change mid-month. So that, again, that's going to be coordination of care between the hospice and the nursing facility. The way things are set up in our system is a plan of care, right? So they're going to have access to that information, and they're going to bill you appropriately. So that's where that coordination comes in, where if there's a mid-month change, they would be billing, let's say, $658 for this amount of days and then maybe $191 for the additional. Next question. So the nursing facilities understand that the hospice provider will not make payment until payment is received from DMAP. So they do understand that. They have a training this afternoon, and we do state that in that training as well.
And it's in the rules.
Yes. So they should understand that. Is there a place to find exactly what is included in Medicaid room and board rate for the nursing facility so that we as a hospice know what we should and should not be providing? So that should be available in the rule as well, right? Okay.
That's in the APD.
Yeah.
Right, and I did reference that earlier on. Next question, what if the patient has Medicare? So we're going to talk a little bit about that. The basics about Medicare. Medicare covers hospice, but it doesn't cover nursing facility services. So even if a client has Medicare, you're still going to be billing Medicaid for nursing facility services. Okay, so let's talk a little bit about care coordination. Okay, so these are the hospice responsibilities. The nursing facility, the social worker, and billing staff are aware of process changes. So that is both responsibility of the hospice and the nursing facility to make sure that everyone involved is kept informed about process changes. The hospice needs to confirm Medicaid eligibility with the nursing facility provider. So you're looking to see if there's Medicaid benefit or qualified Medicare beneficiary. The hospice obtains patient liability information from the nursing facility. So any amount that the patient is responsible for, that nursing facility should report that to you. And then also you need to identify if the client is enrolled in coordinated or managed care. So one of the OHP plans. You want to verify that either on our provider web portal and, of course, coordinate with the nursing facility to make sure. Another responsibility for hospice providers is to complete and fax the DMAP 525 notification form for new hospice service and when client information changes. So this notification form is only for clients who are residing in nursing facilities. So when that client elects a hospice care, you're going to fill out that form and return it to APD. And anytime there's an information change for the client, you would also fill out a new form. Hospice providers are also going to excuse me, submit a bill to Medicaid, and upon payment, they're paying the nursing facility. And just a follow-up question to the previous question. We are billing Medicare for hospice and Medicaid for nursing facility services. Yes, in the event that a client has Medicare, that's exactly what you would do. Next question, when do we start submitting the 525 form for May dates of service? I imagine any time from today forward would be fine to go ahead and start submitting those forms. Okay. So let's talk a little bit about the nursing facility responsibilities as well. So again, the social worker, the billing staff, they're knowing about process changes. That's the excuse me, responsibility for both providers that are involved here. The nursing facility is confirming Medicaid eligibility with the hospice provider. They're monitoring client financial status and liability changes. So that's where they're monitoring the activities of daily living for that client to see if they're eligible for Medicaid. They notify the caseworker for eligibility changes as needed. Okay, so let me repeat that. The nursing facility notifies the caseworker for eligibility changes. The reason they do that is because they're constantly monitoring the client. And then they're also identifying if the client is enrolled in a plan, so either a CCO or an MCO. And again, this is coordination of care. So the nursing facility is verifying these things, but the hospice provider should also be verifying Medicaid eligibility and working directly with the nursing facility on that. The nursing facility is working with the hospice to implement and carry out the patient's medical plan of care. Remember, the hospice is creating that medical plan of care and also the manager of their medical care. Nursing facilities are collecting patient liability and they inform the hospice. That should also be included on their bill to the hospice. You should be able to clearly see what that patient liability is. And then they bill the hospice provider for the bundled services. So those are nursing facility responsibilities. Okay, next question. What if you already have a patient in a nursing facility? If you have a patient that's currently in a nursing facility, you will want to go ahead and submit that 525 form as soon as you can. And then from May 1st, date of service forward, you would want to go ahead and start this new payment process. Okay, so in the first round, MCO and CCO were not included. Are you saying that they are now included and should be billed by hospice? So we're not to billing yet, and the billing has not really changed. But as far as coordination of care goes, you do want to identify if the client is enrolled in coordinated or managed care. So we'll get to the billing and we'll explain that a little bit more in detail. Okay, so the nursing facility collects and keeps the patient liability portion. Yes, that's correct. And then the amount that Medicaid pays would deduct that amount. When a patient is enrolled in a CCO or MCO, do we bill the CCO or DMAP for the skilled nursing facility bundled services? So for nursing facility services, they bill DMAP directly, or do they bill the plan?
For ICF, complex medical add-ons, they bill us direct right now. But, Mr.
It's on. Okay, so we have the billing portion covered a little bit later in the slideshow, whether or not you would be billing an OHP plan, Medicare, Medicaid, any of that is broken down later on in the presentation. So give us a couple minutes and we'll get to that point. Okay, so nursing facility and hospice responsibility. So these are the things that are going to happen between the two entities. So you're going to assure that a current written signed contract is on file and available upon request. And this is between the nursing facility and the hospice. You'll work together to verify, implement, and carry out the patient's medical plan of care. You'll collaborate to anticipate and confirm Medicaid eligibility and OHP plan enrollment. And then you'll coordinate payment arrangements. Now at the bottom here, you'll see a note that the hospice is not responsible for any services included in the all-inclusive bundled rate. And again, you can find out those services in the rule, the APD rule for nursing facilities. And I do reference that rule a couple of times throughout the presentation. Okay, so communication and coordination. Hospice election, so some of this is probably a review. You probably already know this. A physician requests hospice service. If the nursing facility receives the request, they need to inform the hospice provider. And then this notifies the nursing facility and hospice billing staff, social workers, and other staff. So again, that's part of that coordination, that everyone is updated on the most current information about a client. And then if the client elects hospice care, that's when the hospice election form is signed. And then initiate or confirm signed nursing facility hospice contract. And then implement coordination of care. So again, the hospice is the overarching role as the manager of care. And then the nursing facility and the hospice are communicating and sharing care information. Okay, so reporting, here's that 525 form again. This informs APD of the client's hospice election in a nursing facility. And then the Medicaid Management Information System, or MMIS, is updated with that information. Anytime a change occurs for the client, the hospice provider needs to resubmit the 525, and then make sure that you're coordinating all client changes with the nursing facility. So changes would include a hospice or nursing facility discharge, a change in provider, maybe they changed hospice providers or nursing facilities, and also a date of death would require a new 525. Okay, this is the form, the 525 form. So at the top there you'll see form instructions, and then next we have hospice provider information. Client information, so the client nursing facility, eligibility, and their planned enrollment would all be reported there in the client information. And then there's a special area for changes in the nursing facility or hospice provider. So anytime the hospice provider changes or the nursing facility, that needs to be filled out. And then down at the bottom in gray, that's for internal use here at DHS OHA. So now we're going to get into the financial piece, and then we'll talk a little bit about billing. So both providers verify client eligibility. The nursing facility is responsible for collecting patient liability, so they report that information to the hospice, and then they report any changes in liability to the hospice. The nursing facility bills the hospice provider bills, and then you have that broken down there. So the hospice provider is billing Medicare and or Medicaid for hospice services. And then you're billing only Medicaid for nursing facility room and board bundled services. And then once you're paid by Medicaid, you would pay the nursing facility according to the contract. Okay, so let's talk about client coverage. So we'll dig in a little bit deeper here and talk about if someone is on Medicare or Medicaid and if they have an OHP plan. So the nursing facility is always anticipating client eligibility for Medicaid. They notify the APD area agencies on aging eligibility worker. They prepare for the change in client coverage. And they notify staff, social workers, and other staff of any changes in coverage. So both providers, again, are verifying eligibility for Medicaid upon service initiation, before submitting a claim. And again, you want to make sure you're looking for managed or coordinated care or fee-for-service. And then, of course, all parties are kept informed by all the other parties. So if there's any new information that comes to any provider, there should be that coordination of care between the two providers. Okay, Medicare coverage. So again, hospice is covered by Medicare. So you would bill Medicare for the hospice services, and then that Medicare payment is considered payment in full. The only amount that Medicaid would reimburse is coinsurance and deductible. Nursing facility services are not covered by Medicare, so it's always billed to Medicaid. So if the hospice provider is billing Medicare for hospice services, they still need to submit a nursing facility claim to Medicaid. And again, bill Medicaid at the usual and customary rates for that client in that nursing facility. And that's where we come back into those codes, the 4 codes that I listed on a previous page, and those current rates. Again, just to repeat, there are new rates coming as of July 1st of 2013 for nursing facility services. So coverage information, again, this is just kind of a different breakdown there. So for hospice services on the left, clients with other coverage, Medicare or third-party coverage, private insurance. Primary payers are Medicare and private insurance, so you would bill them first. And then Medicaid is secondary and may reimburse coinsurance and deductibles. Clients who have no other coverage, so they don't have Medicare or private insurance, then Medicaid would be primary, and you would be reimbursed per Medicaid rules. Okay, so let's talk about the nursing facility services there on the right. Clients who have Medicare, since it's not covered by Medicare, Medicaid is still primary, and we're reimbursing per Medicaid rules. Clients with no other coverage, again, Medicaid is primary, reimbursed per Medicaid rules. And then we do have the long-term care coverage. That's that last section right there at the bottom of the nursing facility services. Long-term care coverage is primary, and it is considered payment in full. So that's the only time you would bill someone other than Medicaid if you're working with a Medicaid client. Okay, so let's talk about that a little bit more. So if a client has long-term care coverage, everything reverts back to the current process. So the nursing facility would be billing that long-term care rather than the hospice having to bill that, because Medicaid is the only one that's regulated per federal statute to not be able to pay the nursing facility directly when a client has elected hospice care. So for long-term care, the hospice would bill for hospice services. So you would be billing either Medicaid or the OHP plan or Medicare. You would not bill for the nursing facility bundled services for the period of time the client is covered under long-term care. If the long-term care coverage exhausts, so that runs out, then you would use the new process. And then again, nursing facilities, when long-term care coverage is in place, they bill that carrier for the bundled services, and they still continue to anticipate Medicaid coverage. And then they would inform the hospice if the long-term care coverage is exhausted and when that client becomes Medicaid eligible. That's when a current OHP financial plan of care is in place. All right. So eligibility verification. And this is just a walkthrough of what you would do on our provider web portal. So if you're familiar with our provider web portal, this will be a review for you. Once you're logged in, you would click eligibility. You would enter client information, dates of service, and click search. This is the eligibility file. And then we go over each of these sections. So this top section here is client information. So you'll see the client's ID, their name, their birth date. And then if the client has Medicare A, B, or D, you'll see service dates listed there under the appropriate coverage from Medicare. Keep in mind that the dates that you're seeing on our eligibility file are the dates that you searched for on the eligibility panel. Also, you can only search through today. You cannot look at future dates. This will also show you the last dental visit. Might be important for coordination of care. And then the branch ID and phone number. So that's the client information section. Next is the benefit plan and service type, coverage, and copay. So this is where you're looking for the OHP benefit plan. And then I've listed in the box on the bottom what would be covered for nursing facility services. So you usually see more than one benefit plan. So you're looking for one of these basic ones in the table down below. But you'll also see on this one that NFC, that's their nursing facility services, and then state Medicaid mental health as well. So once you see one of these that are down in this box, you can click on it if you like. And then this service type, coverage, and copay will populate and tell you what coverage is active and whether or not there are copays. So just so you know how that section works. And then TPL and managed care. TPL is third-party insurance. That would be listed in the TPL section. And then the OHP plans are listed in the managed care section. So you can see this person has a dental plan, and a mental health plan as of these dates, October of 2012. And then just a couple of notes here. Hospice services for clients not residing in a nursing facility are billed to the appropriate MCO or CCO. Hospice services and nursing facility bundled services for clients who are in a nursing facility are billed to Medicaid. So you're still billing the clients who are not in nursing facilities, you're still billing them to the plan. But if they are in a nursing facility, you're billing Medicaid directly. And I think that answered the previous question that we received. Okay, so that was eligibility. We're ready to move on to billing. So always make sure you're billing appropriate parties. I know I may sound a bit redundant here in repeating these things, but I really want to make sure that you have the right information, that you're billing the appropriate parties. So if your client is not in a nursing facility, if they have Medicare or private insurance, you're billing them as primary, and then you're billing Medicaid. Usually the claims are crossed over automatically by Medicare. And if you're billing Medicaid, you would want to bill the managed care or coordinated care organization if they're enrolled in one. If they're not, then they're what we refer to as fee-for-service, and you would bill Medicaid directly. So if your client is in a nursing facility, then you bill Medicare for hospice, if applicable, and then bill Medicaid for hospice. And you'll notice that the managed and coordinated care, you're still just billing DMAP directly, bill Medicaid directly if your client's in a nursing facility. So all Medicaid clients would come directly to Medicaid or DMAP. And then bill Medicaid for the nursing facility bundled services. Okay, billing details, hospice services use the usual hospice revenue codes, and we reimburse per Medicaid rules. And then for the nursing facility bundled services, you could bill on a separate line from the hospice, use nursing facility revenue codes, and the usual and customary rate for the dates of service, and do not enter Medicare information on the line item. So again, nursing facility revenue codes bypass Medicare edits, so you wouldn't have to enter any of the Medicare adjustment reason codes or anything on that nursing facility line. And then reimbursement is per Medicaid rules. Next question. If the client is in a CCO that we don't have a contract with, then what? So you're referring to a hospice client that is not residing in a nursing facility and you don't currently have a contract with that plan, then they might want to find a hospice provider that does have a contract with that plan, or perhaps you want a contract with that plan. Now, if it has to do with a client who is in a nursing facility, you would be billing Medicaid directly anyway. So as long as you have a contract with that nursing facility, you should be just fine. Is that correct? Okay. Can hospice bill their services separately? Or do both hospice services and nursing facility services have to appear on the same claim? No, it doesn't have to be on the same claim. It can be separately. I'm just giving you the option that you can put it on the same claim because it might be easier for you. It just depends on what your business process is. Okay. So those are our billing details. And then again with coverage information, so we have hospice services on the left, nursing facility services on the right. So for hospice, clients with other coverage, you're billing the other party primary, bill Medicaid as secondary. We may reimburse coinsurance and deductibles. Clients with no other coverage would be billed to Medicaid directly and reimbursed per our rules. And then nursing facilities, so this is kind of a review again. Clients with Medicare is not covered by Medicare, so you're billing Medicaid. Clients with no other coverage, same thing, you're billing Medicaid. And then clients with long-term care coverage, the nursing facility is billing that long-term care carrier. And that payment is considered payment in full. And as soon as that coverage exhausts, again, that nursing facility should be in contact with you and talking with you about that. Next question, will we see sample bills, including a bill where the patient has paid part of the liability? Okay, so we're just chatting here in the room to make sure that we have that appropriate. So I don't have sample bills in the slideshow today. What I will tell you is that when you're billing for nursing facility services, it's the claim form is almost exactly the same as it would be for the hospice services. You would just be changing the revenue code and the amount billed. When it comes to patient liability, that's not something that you're having to report directly on the claim. What happens is, I know I mentioned earlier that there is a financial plan of care set up in the MMIS. That financial plan of care in the MMIS has the patient liability amount on it. And what will happen, let's say you build, and I don't remember the rates, so don't quote me on the rates here, but let's say you build the nursing facility services and you put in $200, and that patient's liability is $50, and it's already reported on the plan of care. What's going to happen is your claim is going to be received by the MMIS, and then you're going to have an allowed amount when you see it automatically in the provider web portal. But when you get the remittance advice, it's going to show that you billed $200 and that we paid $150 because that client has patient liability. So it's going to show on the remittance advice the exact amount. Next question, will this change how we bill respite? And are there sample contracts for nursing facilities and hospice?
Respite is a completely different issue from what we're talking about, and that has nothing to do with the issue we're speaking to, where a client actually resides in the nursing facility. So if you look at the rate chart that you get when we update rates, depending on what kind of, if you're doing inpatient respite care, which is revenue code 655, that's a completely different arrangement that you have with that nursing facility, because that client is not actually living in the nursing facility. That client is supposed to be living at home, and the family needs some respite, or the client needs to go to the nursing facility to get more pain control or something like that. So that's revenue code 655, inpatient respite care, which is separate and apart from what we're discussing here today. So I hope that helps.
Okay, so the next question I have coming in, if the client is in a CCO, then will the state pay the nursing facility charges as well as the hospice? Or does the CCO pay hospice and the state pays nursing facilities? So when a client excuse me, is residing in a nursing facility and they have coordinated care or managed care under OHP, then the state is paying that directly. Is that correct, Judith? Yes. So the only time that you would be billing an OHP plan at this point is if you're serving a client that is not in a nursing facility. If the client's in a nursing facility, then it's bypassing the OHP plans.
I should clarify there that if a client resides in the nursing facility and elects hospice care, but they still are a part of a coordinated care organization or a managed care organization, if there are other charges outside of hospice or nursing facility that are unrelated to the terminal illness, those still would go to the CCO or MCO. An example might be that the client is a diabetic, they've been on insulin for many years, they still require their insulin while they're on hospice, and it's not part of the nursing facility bundled rate, then that would be billed directly to the managed care or the CCO.
Okay, and we have a follow-up question from the respite question, and they were asking if there are sample contracts for nursing facilities and hospice. So are there examples of contracts? And that's the contract between the nursing facility and the hospice.
Right, and I'm not sure if you're referring to a sample of a respite care contract or hospice for a client who resides in the nursing facility, but we do not have examples of contracts. That's between the hospice and the nursing facility. My understanding is that for the nursing facility hospice issues that we're talking about today, there are sample contracts through the National Hospice Association, and I understand those are things that you do have to pay for, but you can check with the Oregon Hospice Association for that specific information, or just go on the national website and you can locate it there. But there is a fee related to those sample contracts.
Okay, the next question on the slide that says clients with Medicare, not covered by Medicare, bill Medicaid. Can you give an example of this? So all that means is that the clients who have Medicare and they are residing in a nursing facility, that the nursing facility bundled services are not covered by Medicare. So even though the client has Medicare, you wouldn't bill Medicare, you would only bill Medicaid. Next question, if a patient is in a CCO, so Coordinated Care Organization, and resides in a nursing facility, will we bill DMAP for hospice services and room and board? Yes. All right. So let's go ahead and move on from here. I think all we have left is some resources for you. So let me look. Look at that, resources. Okay, so we've referenced the two sections of the Social Security Act that we're dealing with here. Also, here are links directly to the Oregon Administrative Rules. So I said quite a few times that you'll find that in the rules. So we talked about the activities of daily living, what services are included in the nursing facility rates. You're going to find that at that link. And then the hospice right here as well. Billing guidelines and tutorials. So we have lots of little step-by-step guides, handbooks for you to bill, either on paper or the provider web portal. And then that last link down at the bottom, this is that hospice rate chart, including the bundled service rates. So I did mention that earlier, that there would be a link to that. Good question. Where do we find the 525 form? Okay, so is it on the DMAP forms server?
If you Google DHS OHA forms, a site will come up and you put in 0525, it will come up. There's also on the front page of the DMAP website, on the left-hand side, it says forms. However, the other day when I tried it, it was not identifying that specific form, but they're correcting that for us now. So it, in the future, will also be there.
Oh, thank you. Somebody said, thank you, and I hope your allergies are better. Thank you. I hope so, too. It gets, when you're speaking and you have to clear your throat constantly, it's fun. So thank you, Deborah. All right, nursing facility. Next question coming in. Nursing facility means skilled nursing facility, not assisted living facility, correct? And then they're asking if this only pertains to skilled nursing facilities. Is that correct? Okay. Okay, and I just pulled up our Oregon Health Plan website, so I wanted to show you what Judith was talking about, that forms server that she was talking about. You'll find it right over here on the left. And how I got to this page is I just Googled Oregon Health Plan, and then I clicked on the one that says State of Oregon.
What I don't know is the other day when I tried it, I couldn't get the 525
Right.
out here. You could try it today. And
But I'm going to go ahead and try it and see if it works, and then if it doesn't, it should be working within the next couple of days because we just had a problem with the forms server. So you'll find forms over here on the left. And then you'll see you can search for forms by going to the DHS OHA forms search page here.
yeah, that's
And then right here in this first box, you would put 0525 and search. It's there. Yay. And then it's already highlighted, so if you just click to view the highlighted document, and then you just click on the PDF here, and you should be able to fill that out. There it is. All right, I was hoping it would work. That worked out well for us. Okay. Next question. Will there be training in the future on how to bill hospice and nursing facility bundled services through the portal? Well, you're welcome to take our institutional claims training. There's one every month, and I can go over that in that training if you would like. So go ahead and take a look at our Oregon Health Plan training page, and you should find that on there. I can show you where that is as well. Next question, does this include ICF? And yes, it does. Okay, so I'm just going back so I can get to the Oregon Health Plan page. So here I am on the Oregon Health Plan page again. On this page, if you look under where it says healthcare providers, there's that orange bar there that says healthcare providers. And then the second section down, free services for providers, this is the training page here. If you click on that, it'll take you to a list of training. And then there's more than one page. So you can either look through it or you can go by topic, provider web portal. And then you'll see as you go through the pages, there should be an institutional claims training at some point. There we go. And then the different dates are listed as well. So there's one on May 9th from 10 to 10:45. All right, next question. When an authorization is needed for a coordinated care plan, is it the primary care provider we need the authorization from?
I'm not aware that an authorization is needed.
As a matter of fact, I have that on my paper too to ask about that. It just dawned on me when you guys were talking earlier whether a PA was necessary for a managed care or CCO for hospice.
Not if they're in a nursing facility, and if they're fee-for-service, prior authorization is never needed. I don't know about specific CCO or MCOs, but if they're an MCO or CCO client residing in a nursing facility, there would be no need for prior authorization for those hospice services because you're going to be billing the state directly for those.
Okay, next question. Was the answer to nursing facility means skilled? Yes. And yes, it was. Nursing facility does mean skilled, right?
Correct.
And then assisted living facility is no.
Correct.
Correct. And if you have any questions after today, you can contact DMAP Provider Services. You'll get a hold of Vivian probably over there. Or maybe not. We have quite a few staff over there that can help you with these questions. There's their phone number and their email address. Also, there's an email address for the DMAP Provider Training Group. So if you have any questions that come to you after session today, go ahead and contact whoever you need to there, and we'll be glad to help you. All right, thank you so much. Have a great day.